I am honored to introduce a woman who has been an inspiration to millions, who has been living with HIV, the founder of the Pediatric AIDS Foundation, Elizabeth Glazer. Thank you.
I'm Elizabeth Glazer. While giving birth to my first child, I hemorrhaged and was transfused with 7 pints of blood. 4 years later, I found out that I had been infected with the AIDS virus and had unknowingly passed it to my daughter Ariel through my breast milk and my son Jake in utero.
It was the early 2000s, a time of unimaginable loss and despair. Eswatini was at the epicenter of an unprecedented health crisis. HIV and AIDS had infiltrated every corner of society and had gripped Eswatini in ways no one could have ever predicted. Mothers, fathers, and children were being ravished by a virus that showed no mercy. Entire families were being torn apart, and the fear of death hovered over nearly every household. People dying like flies due to AIDS-related illnesses. This was more evident in the lives of mothers and children. HIV prevalence was estimated at 27%, making Eswatini declared the leading country in the world. The rate of mother-to-child transmission of HIV was alarmingly high, with countless babies born with the virus. The future looked uncertain. Mothers lived in fear, the fear of passing the virus to their children, and the fear that they might never ever see them grow up. Healthcare workers, often overwhelmed, were desperate for support. At that critical moment of confusion and lost hope, the Elizabeth Glazer Pediatric AIDS Foundation arrived in Eswatini with one mission: to end the pediatric HIV and to save lives.
Hello everyone and welcome. This year marks the 20th anniversary of EGPAF's work in Eswatini, and I'm honored to reflect on our shared journey and the remarkable progress we have made together in the fight against HIV and AIDS. This celebration signifies not only an organizational milestone, but also serves as a testament to the lives we have touched, the children, youths, and families we have supported, and the future we are collectively building.
When EGPAF started supporting the Ministry of Health in Eswatini, that was in 2004, the focus was mainly on prevention of mother-to-child transmission of HIV nationally, that is in all the 4 regions of Eswatini. So pregnant women living with HIV had access to antenatal care services. However, HIV testing was not routinely offered as a part of the package of services. Yet the transmission rate of HIV was around 25% in 2000, as demonstrated by the National PMTCT Impact Measurement Survey. So EGPAF started supporting the Ministry of Health to pilot PMTCT services in 3 facilities, which was Mankayane Government Hospital, RFM Hospital, and KS2, King Sopuza II Public Health Unit.
Hospitals were full. Healthcare workers were overwhelmed and under-resourced. The virus was spreading faster than the country could respond, especially amongst mothers. They came to the clinics with fear in their eyes, knowing their children might be born with the same fate, a life with HIV. They watched in agony as their newborns were diagnosed with HIV. Tiny lives, barely begun, were already facing a lifetime of pain, medication, and uncertainty. Hope seemed like a distant dream, drowned out by the harsh reality that many babies born to mothers living with HIV would soon follow their parents' path. When EGPAF arrived in 2004, there was a glimmer of hope. It brought with them the expertise, resources, and dedication that Eswatini so desperately needed. The foundation began its collaboration with the Ministry of Health with a clear goal-driven focus in the prevention of mother-to-child transmission of HIV. With the mother-to-child HIV transmission rate at 18% that year, the focus was clear: to prevent the transmission of HIV from mothers to their children. All concerned parties, government, EGPAF, and PEPFAR, realized that prevention of mother-to-child transmission of HIV was to be a priority if we were to rescue the future generation of the tiny kingdom. The vision was clear: to save lives.
When the PMTCT program started in Eswatini, it was a very exciting period, as it promised to be a new strategy that was needed. As a country, we were determined that we do not want any child to die of HIV, and therefore when the PMTCT program was introduced into the entire response to HIV and AIDS, we took it upon ourselves and determined to introduce it into the national program with the aim that we want our children to be born HIV-free.
EGPAF, with support from PEPFAR, upgraded some of the facilities that we were being supported by either renovating the facility or procuring park homes to avail space for provision of PMTC services. A facility on point, it's KS2 Public Health Unit. That facility has been renovated, and many other facilities countrywide or in all the 4 regions.
EGPAF, in collaboration with the Ministry of Health, ensured that pregnant women living with HIV were provided access to antiretroviral therapy and life-saving treatment. These treatments drastically reduce the risk of transmission during pregnancy, childbirth, and breastfeeding. What began as a focused effort in 3 hospitals quickly grew into a nationwide initiative, transforming the lives of thousands of families. Smiles returned on the faces of families as they realized that HIV was not a death sentence, as they held their HIV-free children in their arms again.
We want to express our gratitude to PEPFAR through USAID. They have been a partner in this journey, and the results we celebrate today has been due to that partnership that started 20 years ago and has gone on as we had to keep improving the package, integrating what is currently there, what has been proven to be effective against the transmission of HIV between mother and baby.
Mina ngumake phila ngeligciwane. Impilo yami sesikhathi eside sengineminyaka lengiyitholile. Nebantwana abangu-4, 2 boys, 2 girls. Bonke banegative, abanagciwane.
So iqhubekile impilo bese ngithola umntwana sakhanda ukuthi kanze kubalulekile ukuthi mhlawumbe sinceda nayo nemivalo esisho ukuthi udaleke sesisathi sisimo sethu ngokukhuluma namuhla ngisho ukuthi unasekho.
Despite the remarkable success of the prevention of mother-to-child transmission program, some children are still born with HIV. This can happen for various reasons: treatment failure, lack of adherence to medication, or seroconversion during breastfeeding. For some women, the weight of stigma and discrimination creates barriers to accessing care, leaving them and their children vulnerable.
I started out in March 2006 when I was 1 year. In my family, I'm the only child that takes out. When I was 11 years, I became curious and started asking questions about the pills that I take every day. She told me that I was HIV positive and I got it through breastfeeding. She said she did not know that she was HIV positive. That she started acting.
EGPAF work did not stop at treatment. They recognized that a comprehensive approach was needed to truly transform healthcare for mothers and children. Realizing the challenges that were faced by the country at the time, which made it difficult to provide PMTCT services for mothers coming for their antenatal case services, EGPAF, with support from PEPFAR, further partnered with the Ministry of Health to address these challenges. support infrastructure development, renovating clinics, expanding facilities, and providing essential medical equipment to ensure that services could reach the most remote areas in Eswatini.
So EGPAF worked closely with the Ministry of Health to address these health systems issues in order to ensure PMTCT services were routinized at ANC.
To further strengthen the health system, EGPAF invested heavily in capacity building. Healthcare workers received ongoing training, equipping them with the knowledge and skills to provide high-quality HIV care. Mentorship programs were established to ensure that experienced professionals could guide their peers, building a resilient healthcare workforce capable of saving lives.
As EGPAF, we have strengthened the health system and invested in in-service training, clinical systems mentorship, and infrastructure development through innovation, ensuring that quality care reaches every community.
Through mentorship, EGPAF empowered nurses, doctors, and midwives to be leaders in the fight against HIV. This hands-on support gave healthcare workers the confidence to navigate complex cases, implement new practices, and ensure that mothers and their babies receive the best possible care. None of this progress would have been possible without the support of key donors. PEPFAR through USAID has been a steadfast partner in funding life-saving programs across Eswatini. Their investments have transformed healthcare infrastructure, scaled up HIV services, and enabled access to treatment for the most vulnerable populations.
With the determination to prevent the transmission of HIV from mothers to babies, we recognize that we could not do it alone as a country. We needed to establish strategic partnerships, and our hands were open to partners that were coming in to offer the technical and financial support. So today, the results that we celebrate and see, where we have reduced mother-to-child transmission to very low levels, such that we are targeted for elimination, we can see that it's a result of collaboration, strategic partnership, working together with a shared vision and a shared goal.
Throughout this journey, the dedication of healthcare workers has been remarkable. They have been on the front lines of this battle, tirelessly delivering care, embracing new interventions, and ensuring that mothers and children receive the treatment they needed. Their willingness to adapt and to learn has been crucial to the success of the PMTCT program in Eswatini.
Alongside other key interventions, which were actually game changers towards our fight against mother-to-child transmission, there was the introduction of point-of-care testing technologies, which helped us to deliver results promptly to the women, and also enabling the immediate start or initiation into care for both the mother and also their babies, and also responding urgently to the needs of the client. And with the ongoing mentorship from EGPAF, this ensured that our healthcare workers' skills are enhanced and they are being supported to improve the service delivery, as well as ensuring that there are no clients who are missed throughout the system.
Today, thousands of babies are born HIV-free. One would take this opportunity to thank our dedicated healthcare workers that took it up and ensured that they deliver the service. They would not have done that very well and effectively without the partner support through EGPAF, the technical support, and being able to tap onto the global network that EGPAF has. We've been managing to introduce and deliver quality services.
A lot of children today, they have an HIV negative result after delivery, except for those children whose parents or whose mothers have tested negative during ANC. and they then seroconverted and tested positive maybe during breastfeeding.
Luhlelo le-MTCT lisite kakhulu livikele nje ukuthi kwehle bantwana labatholakala negciwane. So kule minyaka lengihleli la uma ngikhumbula kahle ngathi kumbe abenze 3 bantwana lesike sabathola bomake bathathe amaphilisi abo lehle kakhulu lelo zinga.
Today, the results are clear. Thanks to EGPAF's interventions and the collaborative efforts of the Ministry of Health, PEPFAR, USAID, and healthcare workers across the country, the rate of mother-to-child transmission of HIV in Eswatini has dropped from 18% in 2004 to just 1.34% in 2022. Thousands of mothers have given birth to healthy, HIV-negative children, and families have hope for a brighter, healthier future.
Mina kuba negciwane ngilitholile 2008 still solo ngiphila nalo. Ngize ngaba nebantwana lababili. Senginalo legciwane nokutesta kwabo ngeke ngabathatha nabo ngade batisa sibhedlela ngade ubatestisa ngakhanza ukuthi bona baphilile begciwane ngoba benginalo kwesaba ukuthi ngade babe nalo ngokube ngiba kwabo. Nalo makwabo yena bevele kude style singababona abantu. Ungijabulise benaloko nje baba manana manje ngisaphela futhi sengivekela abantu abami sengike ngibone ukuthi bona solo baphila njani aphizete nabathayi manje bantwana solo bahlobile.
Over the years, EGPAF's scope of work in Eswatini has expanded to include other areas of interest to address the broader needs of families and communities. While maintaining her focus on ensuring that children are not left behind in the provision of health services, today EGPAF provides comprehensive care and treatment services, ensuring that children and adults living with HIV receive life-saving medication and support. The foundation has also integrated tuberculosis services, recognizing the critical link between HIV and TB, one of the leading causes of death among people living with HIV. In addition, EGPAF has expanded its reach to offer comprehensive HIV prevention services, including education, counseling, and access to preventative treatments like pre-exposure prophylaxis, PEP. As we commemorate 20 years of impact, we celebrate the partnerships, the progress, and the lives saved. Together, we have made a lasting difference in the fight against pediatric HIV. Together, we will continue to work toward a future where no child is born with HIV.
As we look back into the 20 years, celebrating what we have achieved, it is not yet over. We still need to look ahead with the hope and determination that has taken us to this far, and look and ensure that we maintain the gains that we have, and we continue to pursue that no child is born with HIV.
On behalf of Elizabeth Glaser Pediatric AIDS Foundation, I extend my deepest gratitude to the government of Eswatini, PEPFAR, USAID, other donors and partners that we have collaborated with.
We remain committed and leaving no one behind. We just urge everyone to come into the agenda and ensure that Eswatini children are born HIV-free.
Together, we have achieved what once seemed out of reach. Together, we'll continue to save lives, prevent HIV, and build a future free from HIV for all children in Eswatini. Let's continue fighting for an AIDS-free generation.
Together with our healthcare workers, together with our partners, together with partners that will come into the fore, no child should be born with HIV.
I challenge you to make it happen, because all our lives, not just mine, depend on it.